So, doctor, lots of questions today, and I'm going to start with one that actually surprised me, okay? And I'm sure you're going to be able to chime in on this and tell us why. There have been reports that some men who have had the COVID-19 virus are experiencing the unfortunate side effect of impotence. So this is new to me. And is this a known side effect? What is going on? And I'm sure they're not happy.
Yeah. So once again, another reason for everybody to go get vaccinated, because this is sort of relatively new. First, let's define what impotence is. So first we got to discuss what exactly we're talking about. So when somebody is not able to achieve or maintain an erection that's rigid and sustainable enough for the entire sexual intercourse, that by definition falls into the category and the definition of impotence or erectile dysfunction. Now, the interesting thing about COVID is that we know that it affects many different organs. This is a virus that actually affects the endothelium, or the lining of the blood vessels. We know that because there's been reports of people having heart attacks after COVID, developing clots, and more recently, our my colleagues at the University of Miami, Dr. Ramazami, Dr. Masterson, they've discovered on biopsying the actual corpora of the penis during a penile surgery that was done because the patient developed erectile dysfunction after COVID, that there was evidence of the virus in that tissue, which should not be strange or odd because we found this virus in many different aspects of the body. The penis being one of them, and of course the penis is a very vascular organ, and so the endothelium, or the lining of the blood vessels, would be one of those targets for this disease to be and find its way in there. Now, we're not sure if it directly gets in there by going and having a key to be able to get in there, or if it has to do with the inflammatory reaction. We know that when somebody has COVID, they develop what we call cytokine storms, which is all this inflammation. That's why the lungs take a hit. And so from that inflammation, you have a breakdown from some of these barriers, and that will make will allow the virus to get into it. So pretty new stuff. Again, this is a sort of a case. There's been 2 cases that they've discovered this at the University of Miami, and we're not 100% sure the full effects and if this is something reversible or not. We do know, and I, in my own experience, doing most of the bulk of my practice is sexual medicine. So I have seen a few cases of people whose erectile dysfunction worsened after having COVID. These are men that mostly have had really severe diseases. But the conclusion, we don't know 100% yet. And I think over the next few months, we're probably going to see a little more evidence to discover and try to figure out exactly how this is affecting a man's penis.
Okay, so I have a couple of follow-up questions, so I'm going to throw them at you. Obviously, it's not that prevalent, so that you already answered, check. Do we know the age of the men that it occurred to? Because I can only imagine that, my husband and my father will now be going, well, ¿cuál fue la edad? What was the age? And is it permanent? And do I get the vaccine now because of this new news? So I'm just going to throw out the questions that I think I would hear from my dad and my brother and my husband.
Yeah, I got to tell you, we really should use this as a great motivator for the vaccine campaign that they got. They did studies where they had 2 packets of cigarettes. One of them said may cause lung cancer. The other one said may cause erectile dysfunction. And everybody that was a smoker bought the one that said lung cancer, but left the erectile dysfunction alone. So, we don't quite, again, we're not 100% sure exactly how this is happening and who this is going to affect. The cases that were reported were on older gentlemen. I don't want to define old because, of course, it's all relative. But these were men in their 60s. They reported, 50s and 60s, they reported that they didn't have much erectile dysfunction before the COVID. It didn't really discuss too much how severe, it was severe COVID in the sense that it wasn't just, hey, you know what, I have a little headache and I lost my sense of taste and smell. We expect this to happen in men who have more severe COVID, the severe symptoms. There's also, of course, a very similar results with the infertility side, which I think hopefully we'll be able to touch upon later on in this episode. But again, I think another reason for men to go out there and get vaccinated is so that they don't put themselves at risk for this. We know erectile dysfunction is a multifactorial disease. There's a lot of different things that will cause a man to develop issues with their erections, whether it be the aging process, the the issues with their arteries and veins, issues with the nerves, and medication side effects from treatments for cancer, hormonal abnormalities, and it's usually a combination of everything that really makes a man develop issues with erections. Now, the bad news is, of course, it's inevitable. Every man will eventually develop some issues with erections. The good news is that every man should realize and feel comfortable enough they're going to have sex until the day they die, because we have a lot of different treatment options for you. And so, of course, when I tell my patients out of my office, they all leave with a huge grin, because I tell them you're going to have sex until the day you die. It won't be like when you're 18 years old, but you're definitely going to be able to have intercourse, because that's our job as urologists, especially me being a subspecialist in sexual medicine. That's really my passion, what I pride myself in, and the bulk of my practice is sexual medicine.
And Doctor, I'm glad you brought up the male infertility. It's a great segue to show our viewers a clip from a recent Health Channel town hall on this topic. So let's take a look at this town hall discussion, and we'll talk about it when it's done. Take a look.
I've heard also rumors in the conspiracy world that this is going to affect male fertility. Is it going to affect male fertility?
We know that COVID-19 infection certainly is associated with impaired sperm function from studies that were done right here at the University of Miami, Miller School of Medicine. So we know that the virus can actually infect the testes and impair sperm function. But as far as the vaccine itself, the COVID-19 vaccine, it has no effect on male infertility or on sperm function.
So, Doctor, your thoughts on this, because I think it's important to clarify that as well.
Yeah. So let's talk about what happens to a man's testicles if they develop or they become infected with the virus. So again, it all depends on the severity of the symptoms and the severity of the infection. If we're talking about, again, a mild infection, somebody who didn't have fevers, you're probably not going to have too much, it's not going to have too much of an effect on your fertility. Now, the guys that, again, have high fevers, have had a lot of symptoms, these are the men that we worry about. And we're not, again, quite sure if this is a direct infection of the COVID virus to the testicles or because of this cytokine storm. Again, all the inflammation that somebody develops, that breaks down what we call the blood-testis barrier and allows the virus to get in there. And we're not sure if it's the virus that causes it or this reaction, this inflammation that may affect a man's spermatogenesis, ability to produce good sperm and amount of sperm. Now, it seems, at least from a fertility standpoint, because this was discovered before the impotence. The impotence part is fairly new, also by the same group run by Dr. Ramazami over there in Miami. Most guys seem to recover their function from a fertility standpoint, meaning spermatogenesis, which is the body's production of sperm, probably the most sensitive thing we do. It's very sensitive. Many different things can make a man's testicles not function appropriately and not produce the appropriate sperm. That's why the testicles, they're so sensitive to temperature. When you're hot, a man's scrotum drops because it wants to be a certain temperature. When it's cold, it gets real close. And so when somebody goes through something like COVID, they get sick, they have a lot of fevers, that will affect somebody's fertility, but we suspect that this is reversible. And we've been showing that as men are able to regain function and regain normal sperm production. Now, again, another reason to get the vaccine. There's never been they haven't shown that the vaccine itself will affect a man's fertility. Quite the opposite. You want to protect yourself from COVID, and the best way you can do that is by having the vaccine on board and preventing you from developing. You can still get COVID, but the likelihood of you developing these more severe symptoms is much lower when you're vaccinated. So again, the campaign should be, get the vaccine to protect your penis and testicles, I think, because to a man, that's probably the most important organ in their body.